Well, welcome to this week's case. Now, do you know the difference between sinus rhythm and normal sinus rhythm? Well, this issue has come up a few times this week, so I thought we'd talk about it and put it to rest. Now, take a look at these three tracings and tell me if you think this is sinus rhythm or normal sinus rhythm. Tracing A, I see P waves and QRSs, but the P waves don't precede every QRS. And, the atrial rate is 84 beats per minute. This is junctional with an escape rhythm of 48 and a third degree AV block. But is this sinus or not? It is sinus. Why? Because every impulse, every atrial impulse arises from the sinus node. So it is sinus. How about tracing B? Now, tracing B has, well, a slower rate, obviously. And if you look at it, it actually has P waves of similar morphology, followed by a QRS complex in each case. And this is actually sinus bradycardia at about 54 beats per minute. And this, too, in fact, is a sinus rhythm because the sinus impulse comes from the sinus node. And tracing C, well, this is a little bit more confusing because there are P waves that kind of are pretty close to the T wave peak. And so it looks like the T wave itself is a little bit, biphasic or a little notched. So because of that, it's confusing. But if you count out the P waves, there are actually P waves following, preceding every QRS complex, but there's a delay. There's a delay of more than 200 milliseconds, and this is what makes it sinus tachycardia with a first degree AV block. So this, however, still is a sinus rhythm because the impulse originates from the SA node. So all tracings, in fact, are sinus rhythm. So are they, though, normal sinus rhythm? Well, the answer is they're not normal sinus rhythm because to be normal sinus rhythm, they must have about 6 characteristics. What are they? In normal sinus rhythm, the atrial impulse must originate from the SA node, sure. And every P wave must precede the QRS complex. Yes, I can see that. The PR intervals must remain constant because if they're not constant, it means that they're coming from different portions of the atria and therefore not sinus in origin. The P wave axis in normal sinus rhythm should be upright in leads 1 and limb lead 2 and inverted in AVR. If this isn't the case, then again, it's a sign that the P wave is not originating at the sinus node. All right, the QRS complex is typically narrow, less than 100 milliseconds. And lastly, in adults, in normal sinus rhythm, the rate is typically between 60 to 100 beats per minute. So that's it. That's the difference between normal sinus rhythm and sinus rhythm. So that's it for this week, guys. Thanks for joining me. This is Serge. Until next week, take care.